Hello and welcome to South First. I am Sumit Jha. India's fight against rabies is at critical juncture. Despite being entirely preventable, the country continues to witness thousands of dog-mediated human deaths each year. A recent nationwide survey published in the Lancet suggested that while 80% of public health facilities stock anti-rabies vaccine, that is ARV vaccine, only 20% have rabies immunoglobulin, RIG vaccine, a vital component of post-exposure to prophylaxis, that is a severe bite cases where a person is required to have RIG vaccine. Joining us today is Ms. Khushboo Daga. She is the Chief Executive Officer of VINS Bioproducts Ltd, a leading Indian biopharma company and global supplier of equine-derived immunoglobulins for rabies and other critical conditions. VINS exports to over 100 countries and plays a key role in India's public immunization program. We'll discuss the current status of rabies vaccine availability in India and what it means from a pharmaceutical supply and manufacturing perspective. Welcome, Khushboo. Welcome to South First.
Thank you. Thank you, Sumit, so much.
So my first question to you, could you briefly explain what RIG vaccine is and how it works in tandem with anti-rabies vaccine, and why it is crucial for managing severe animal bite cases, which is described as type 3 or type 4 bites in India?
So basically, RIG, which is the rabies immunoglobulin, equine rabies immunoglobulin, or we call it anti-rabies serum. It's a serum which is derived from equine plasma of a horse. When the plasma of the horse is separated from the blood of the horse, and it is processed and it is manufactured and converted into an anti-rabies serum, which is an injectable, which should be ideally given at the time of the bite in any category 2 and above bites. So basically, these are antibodies which are given at the time of the at the time of the bite, so that it can neutralize the bite. Vaccine can take anywhere between 7 to 14 days to act. So meanwhile, if you're still exposed to the virus, these antibodies can take care of the neutralization of the virus. So they should be given along with the vaccine. And according to WHO also, it is mandatory to give the anti-rabies serum or rabies equine immunoglobulin along with the vaccine in every category 2 and above bites.
So a recent survey, which was published in Lancet, suggested that 80% of ARV vaccines are available in public facilities, while only 20% of RIG are available there in these public healthcare system. So what do you think? Why do you think this gap exists, and what are the real world consequences of this shortfall of RIG vaccine in our public healthcare system?
The gap was quite wide, but thankfully, maybe due to the more awareness and all, now consumption of rabies equine immunoglobulin is going up. It could be a combination of various factors. It could be non-awareness in the doctors and the paramedical staffs that this also needs to be administered. Secondly, it could be the whether the patient is willing to take it or not willing to take it. Third could be the availability of anti-rabies serum. Fourth could be a cost point also. But anti-rabies vaccine, anti-rabies equine immunoglobulin is not a very expensive drug, So it is quite affordable and it can save your life. It is called as a life-saving drug. So these are various factors due to which maybe the consumption is not very high.
So India still sees estimated around 5,700 dog-mediated deaths annually. In your view, what are the key bottlenecks leading to these preventable deaths from perspective of access to passive immunization like RIG? What are the bottlenecks which stops from preventing this rabies-mediated death in India?
As I just mentioned, Sumit, that these are the various factors. If these are not followed, this could be the reason that the patient is not given either by the doctor because the doctor himself is not aware, or maybe the patient is not willing to take, or maybe the product is not available. In that case, if it is not given at the right time, or even if it is given at a very, very later stage, the patient might actually succumb to death.
Okay. So can you walk us through how the supply chain of RIG typically works in India? It's equine-based immunoglobulin, and it's different than ARV. So, how, like, from manufacturing to reaching a primary health center, and how do you see that, where is the bottleneck in the supply chain that stops it from reaching to the public health centers?
Okay, so equine rabies immunoglobulin is predominantly bought by the Ministry of Health. Like they float the different tenders. So every state has an organization which floats the tenders for these
Right.
products, these drugs. And whenever the Ministry of Health they float a tender, whoever is the L1 supplier, let's say VINS is the L1 supplier, so they give us a purchase order of a specific quantities and they give us the multiple destinations. Let's say if it is for Rajasthan, they will give us multiple destinations, or if it is for Kerala, they will give us multiple destinations. We need to ship the product to their warehouse. And
Okay.
so that is how we need to maintain the cold chain temperature. We need to maintain, because it is a 2 to 8 degree product. It is a liquid product, so it needs to be maintaining the 2 to 8 degree temperature. So we ship the product from our warehouse and we make sure that it reaches the all the consignees and all the warehouses, whichever addresses are given to us, in the correct form and in the correct condition, cold chain condition. And
So,
from there, they stock it in their cold chains, warehouses or cold rooms and all, and that is how it is consumed.
I have a small question here that while I was reading that Lancet report, there was mention of non-availability of cold chain among these public health infrastructure. Where does manufacturer responsibility end for the cold chain supply, or can manufacturer also provide the cold chain facility to these public health infrastructure?
Honestly, things have become much better, especially after COVID, because the vaccines were also required to be stored in 2 to 8 degrees. So in India, I would say the situation is still better off than in every other country, like in Africa and all. The situation is much better, and we do have cold storage facilities. Yes, there could be a stringency on the capacity of the cold chain storage, so because obviously a lot of vaccines and a lot of immunoglobulins are required to be stored in cold chain. So there could be a stringency on that part, that okay, the capacity is not enough to store a very wide number of equine immunoglobulin, but it is there. But as manufacturers, we do make sure that our product reaches the warehouses properly, and but after that, storage is their responsibility.
Uh, about your manufacturing facility, VINS runs these special horse farm to produce life-saving medicines like rabies, immunoglobulin, that is called equine-based RIGs. And these farms follow strict animal welfare rules set up by government or CPC, SCA. Can you explain how these horses help in making the medicine? Because most of us, many of, I was also talking to a few of my colleagues, and they were not aware about how these antibodies are being produced. So, and their question was also that how is it ethical to produce these vaccine? You are harming an animal to get the vaccine out of them. So, can you explain the steps taken by your pharmaceutical company to make sure that animals are treated ethically and also kept healthy during the process and produce the vaccine?
Yes, of course. Each animal is a child like to us, and all these animals. First of all, our company is governed by CPCSEA, so they have very strict guidelines which we adhere to. They have the inspections of our facility and our paperwork and everything, which is continuously keeps everybody in check. Um, there is no harm as there is no harm in the process of producing antivenoms or antiserums to the animals and all. So basically, we procure the animals at a certain age, which is the right appropriate age for animals to be given the venom. We do all their quality checks, all their health checkups and everything. We feed them properly. We give them all the required nutrition and all, so that their critical parameters do not fall. And then there's a very, very, very small dosage of the venom which is given to them, so it does not affect their organs, or if it doesn't affect their system and all. And they are given a lot of care in terms of veterinary care, in terms of nutrition, in terms of food, fodder, and everything. And we take care of them. And when they reach a certain level of antibodies, then they are bled,
Okay.
and then antibodies are already drained. So this is a process, and in between there are rest periods also, which are given to the animals. So the process is not very strenuous to them.
Okay.
Yeah.
So I'll move to next question where I want to know about like the changing trend as well. There's increasing global attention on monoclonal antibodies (RMAV) as an alternative to traditional this RIG, like which is sought to be the best amongst the vaccine right now. So how do you view the future of passive immunization? Is it the case of coexistence with both RMAV and RIG, or is it a shift where you see that, okay, uh, this RMAV is going to be the next thing after RIG?
I mean, honestly, economies of scale, affordability, the level of production, because to cater to such a huge population, to cater to the cases of increasing number of bites,
Hmm.
availability of the product should be there. So it has, I mean, all these parameters have to be in sync: production, cost, availability. So, I mean, monoclone is available already, but still, I feel equine rabies immunoglobulin is the one which is sold the most.
I'll go back to the question which I asked earlier, and you answered that there is a process of procurement where government put out tender and companies participate in it. So, do you see that uh, like is there any hurdle uh, in supply chain because of the process of tender as well as the time it takes time taken by the states to put these tenders.
Yes, Sumit, see, I mean, India has made a very systematic way of floating the tenders, and finalizing the tenders and procurement policies and everything. But sometimes state to state there can be challenges
Mhm.
where the tenders are not getting finalized for quite some time due to their own issues of maybe availability of funds, or different things. So there could be challenges like that.
Okay. So, in your suggestion, what reforms can be made to change these process? Because uh, uh, as far as I know, like even some states like Telangana, if a tender is floated for any medicine, it takes at least 3 months to get start procuring. So, what changes or what reforms do you see that these tenders should have now?
But normally, what happens is, suppose in case the old RC is valid for another 3 to 4 months minimum, usually the
Mm.
tenders are finalized before the RCs are expiring.
Yes. Mm.
Or in that case, they also sometimes extend the RCs for a couple of months, 2 to 3 months, and if they feel that the tender is going to take slightly more time to get finalized. So that is the situation. But maybe centralized procurement could be one thing where government can look into it, and there is a centralized procurement of it, and then they do their own distribution to various states.
Uh, So, VINS supplies to over 100 countries. How does India's demand and planning of public health? So, my question is from public health perspective here. That how does India's demand planning and public health coordination for rabies vaccine compared to other countries, where you also supply to other countries, over 100 countries? So, how do you see that? How it is different than other countries in India?
I would say, in fact, India is very systematic in their procurement. I've said this before also, but I'm again repeating to you that India is because India is a very large country.
Yeah.
So, and we have so many states. So unless and until it is not divided properly by in different states, the procurement process over here is very systematic. Sometimes, yes, there are some issues where tenders are not able to finalize, or there are payment issues, or so that is the thing. But otherwise, India has a very systematic way of procurement. But maybe what we can improve more is going deeper and deeper into the rural areas and all the primary health centers, and making sure that the product is available. the cold chain is available, and the doctors or the paramedical staff is available to administer the product properly to the patient.
My second last question. I was recently reading about snake bite as well, snake bite cases, and VINS also produces snake bite venoms as well.
Yeah.
So one thing I realized from a few of the stories my publication have also done, that snake bite is not a notifiable disease, and due to that, the vaccine which should be given to the patient is it not available everywhere. So how is it different than the rabies vaccine supply in India? How is
Actually,
venom vaccine is different?
Actually, snake bites have just become notifiable a couple of months ago only in India. So that is a very one big progress which we have made, that any snake bite which happens, which needs to be notified. So actually, we will actually get the correct statistics, that how many bites are happening and how many people are losing their lives. So a lot of data will be collected, and which will help the governments to plan their procurement better, and henceforth all the manufacturers can plan their production in a much better way. I feel we can really, uh, decrease the number of deaths and mortality which happens due to snake bites.
I was not aware that it has been notified. Right?
They become notifiable, yeah.
My last question: with India committed to zero by 30 goal or to eliminate dog-mediated human rabies death, what would your top 3 actionable recommendation to improve RIG accessibility from manufacturing scale up to policy and public-private partners? What is the improvement you want to see in all these aspects?
One is a very systematic procurement again. Secondly, maybe if center can intervene, and if they are making it as a mandatory, because now and when we keep seeing articles where people are losing their lives because they've just been given a vaccine and they've not been given an immunoglobulin, or maybe immunoglobulin was given at a very very later stage when they realize that the patient life is getting out of hand or the situation is getting out of hand. So maybe awareness in doctors more and more to correctly administer the product. So that is one thing. And of course, they can only administer the product when it is properly available in all the areas, in all the health centers and hospitals, wherever the patients are going to. So that will be, again, one big thing, that procurement should be there. And the cold chains are there, cold chain effective systems are maintained so that the product can be stored properly. Because there are cases actually where the product is available, but it becomes ineffective if it is not stored in a proper storage condition. Yeah, see, 2 to 8 degrees is the advised condition. So if it is not stored properly for a very long time, of course the stability is there, but for a shorter period of time. So the product should be stored properly in 2 to 8 degrees.
Okay, so from availability to trading to cold storage presence in all these public infrastructure is quite needed for this to success by 23.
Yes.
Thank you, Khushboo. Thank you so much for speaking to Southwest.
Yes, thank you. Nice talking to you.